Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly subscribe and share for more. Ever wondered how vital your lungs are to your overall health? Well, let's delve into it. Imagine the lungs as the bellows of life, inflating and deflating tirelessly to supply the oxygen our bodies crave. They're our personal life support machine, working round the clock, ensuring every organ, every cell gets its share of oxygen. In the grand symphony that is our body, lungs are the maestros, conducting the rhythm of life. Without healthy lungs, our bodies would struggle to survive. So, what could potentially harm these vital organs? There are several factors that can cause lung injuries. One of the most common is smoking. When you inhale tobacco smoke, harmful substances are absorbed by your lungs, leading to damage over time. Even secondhand smoke can be dangerous, especially for infants and children. Another cause is exposure to harmful substances in the environment. This can include asbestos, radon, and certain types of dust or fumes. These substances can cause inflammation and scarring in the lungs, leading to long-term damage. Infections like pneumonia and tuberculosis can also harm your lungs. These diseases can cause inflammation and damage that may lead to serious complications if not treated promptly. Lastly, physical trauma such as a car accident or a fall can cause acute lung injury. This can result in difficulty breathing and other severe symptoms that require immediate medical attention. Knowing the causes is the first step towards protecting our lungs. But how do we know if our lungs are in trouble? Well, there are several signs and symptoms that can suggest lung injuries. One of the most common symptoms is shortness of breath. This might feel like you're constantly out of breath, even when you're not moving around much. Another frequent symptom is chest pain. This can range from a dull ache to a sharp stabbing sensation. You might also notice a persistent cough that doesn't seem to go away. This could be dry or it could produce mucus. Unexplained fatigue, even after a good night's sleep, can also be a sign of lung problems. It's important to remember that these symptoms can be caused by a variety of health issues, not just lung injuries. So if you're experiencing any of these symptoms, it's crucial to see a healthcare provider for a proper diagnosis. Recognizing these signs early can be crucial in preventing further damage. So, you've identified the signs? What's next? Once suspicion of lung injury arises, doctors typically use a combination of imaging tests like chest x-rays or computerized tomography scans to gain a clearer picture of the lungs. A pulmonary function test might also be conducted to assess how well your lungs are working. Treatment for lung injuries is designed to provide relief from symptoms and prevent further damage. This could involve medications to manage pain and inflammation, oxygen therapy to ensure you're getting enough oxygen, or even surgical procedures in severe cases. The main goal is to stabilize the patient's condition and prevent the injury from progressing. However, it's important to remember that every treatment has its potential risks and side effects. For instance, long-term use of certain medications can lead to other health issues, while surgical intervention brings risks like infection or reactions to anesthesia. And what if lung injuries are left untreated? Complications can be severe, ranging from respiratory failure, where the lungs can't provide the body with enough oxygen, to a collapsed lung, also known as a pneumothorax. In the worst-case scenario, untreated lung injuries can even lead to death. It's clear that lung injuries should not be taken lightly. They require prompt attention and careful management. Remember, the sooner you seek help, the better your chances of avoiding these serious complications and making a full recovery. Prompt diagnosis and treatment can prevent complications and save lives. But wouldn't it be better if we could prevent lung injuries in the first place? Absolutely! Prevention truly is the cornerstone of maintaining good health, and there are several measures we can take to safeguard our lungs. Firstly, bid farewell to smoking. It's no secret that tobacco is a leading cause of lung damage, and saying no to it is the best gift you can give your lungs. Secondly, be mindful of what you're breathing in. Harmful substances like air pollutants and chemicals can wreak havoc on your lungs. So, whether it's at work or at home, make sure to minimize your exposure to these destructive elements. Lastly, don't forget the importance of maintaining good overall health. Regular exercise and a balanced diet can go a long way in keeping your lungs strong and healthy. And remember, it's not about living in fear. It's about making smart, informed choices. Remember, prevention is always better than cure. To sum it up, our lungs are vital, and we must take good care of them. Remember, lung injuries can be caused by various factors, such as smoking or exposure to harmful substances. It's crucial to recognize signs and symptoms early, like shortness of breath or chest pain. Timely diagnosis and appropriate treatment can mitigate complications. Prevention, however, is our best defense. Avoiding risk factors, maintaining a healthy lifestyle, and regular checkups are key. Let us breathe easy, knowing we're doing all we can to keep our lungs healthy. UMCC, your ultimate medical consultant connectors.